Anxiety and autism spectrum disorder, ASD or autism, frequently co-occur with one another. And in teenagers, this creates a unique set of challenges, especially in this period of life for them. And as a parent or a caregiver, knowing how anxiety and autism interplay with one another in your teen is going to better help you understand how to help them, especially during this really difficult time in their life. So hi, my name is Dr. James Thatcher. I'm the clinical director here at Forest Psychological Clinic. And before I get into this video, I want to talk about why I'm doing these videos first. So I just want to point out, doing YouTube videos takes a lot of time. Scripting these, researching them, filming, editing the film, uploading them, it takes quite a bit of time. So why do all of this? Well, it's the same reason why I got into psychology to begin with, is to help people. My idea is if I help just one person through these videos or the work that I do, then it's all worth it. All these hours, all this time that I put into it, if I help just one family, one teenager live a better life, or one parent be able to connect with their teen and bond a little bit better, I would have done my job. That makes it all worth it for me. If you like these videos, please hit like and subscribe. It really helps YouTube and myself know that you're enjoying this content so I can make more. Because again, I really want to make content that's impactful, that helps you. Okay, so let's get into the video. Studies suggest that 84% of teens on the autism spectrum experience an anxiety-related disorder compared to just 20% of neurotypical teens. This isn't coincidental. There's several autism-specific factors that increase or heighten their vulnerability to being anxious. One of those is sensory sensitivities. I want you to imagine that when you walk into a crowded area, that the noise becomes painful. Or when you walk into a doctor's office with those overhead lights with the fluorescence going on, that it becomes overwhelming and you can't concentrate. Imagine that you put on a piece of clothing that just feels like steel wool grating on your skin. Having these sensory issues surround you all of the time increases the likelihood that you're going to be anxious. And for autistic teens, the world is full of these sensory issues that can trigger their anxiety. Another thing would be social communication issues. Being able to pick up on social cues and rules, engage in conversation, have a back and forth reciprocal conversation. Those things are a lot harder for an autistic teen, and they know it. They know that these things are difficult for them. These unwritten rules are like being able to read a language that no one has taught you before. Being faced with these social challenges day after day after day. How did I say this thing? How do I engage with that person? How do I initiate this conversation? Those things aren't happening naturally to them. So all of that can be very anxiety provoking. And another thing is insistence on sameness. Having the same routine day after day after day can help reduce anxiety, and autistic teens tend to like that. However, with being a teen and just in general life, routines aren't always followed. Different things pop up over time, and when that does, it's very overwhelming and anxiety provoking for them. So how does anxiety manifest itself differently in teens that are on the autism spectrum? And what you see as a parent might look a little bit different than what you might see from a neurotypical teen in regards to their worrying and worry-like behavior. So one thing you may see in your teen is a lot more repetitive behaviors or engaging in their fixated interests. So if they're engaged in something and they're doing a deep dive on something that they're really interested in, this could be a sign that they're seeking comfort from what they enjoy versus dealing or coping with the fear. Another thing to look out for is just sudden meltdowns or shutdowns that are disproportionate with the situation when they weren't necessarily doing that before. They just seem way more on edge. Another is sleep disturbances or differences in their eating patterns, to where maybe they're eating too much or too little, or sleeping too much or sleeping too little. They've gotten off the schedule. And another one is an increased need for rigidity in their routines, whereas before they may have been more open to different transitions and changes in their routine, but now they're not. And it is a big deal that you're not going directly home after school, or that you have to run this small errand, or what you said was going to happen this next weekend didn't happen. Now it's a big deal, whereas before they were able to deal with it. And another thing to keep in mind is autistic teens tend to have a more difficult time identifying and talking about their emotions, which makes dealing with anxiety even more difficult for them. So, what may appear as a behavioral problem really may be their attempts to try and cope with their anxiety. So, let's get into some ways that you can support your teen. One way to do that is to build predictability. Research shows that having environmental predictability greatly decreases anxiety in teens. One thing that you can do in order to help with this predictability is have a visual schedule of what you guys are going to be doing that day, or what's expected of them in their chores or what they need to get done. Having it visualized can help. One way to do this is have visual schedules or calendars. That way your teen can go in and look and see what's expected throughout the day or what's coming up in the next week or so. And I should say some of these suggestions are for the various levels of autism. So maybe your teen would fall on more of a level 1, or maybe they're more of a level 2. So I'm going to try to speak to all of these different things. And I'll also put at the end of this video, and hopefully in the description down below if I can remember, a link to a video that talks about the different levels of autism and how that can present itself. Another thing you can do to help your teen have the environment be a little bit more predictable for them is to go over what new things are going to be coming up. Go over it in detail, show them pictures. If you're going somewhere new, you can show them where that place is. For instance, is if your teen is getting ready to go to a new school or go off to college or move to a new place. These are huge transitions for anyone. And for them, that is a huge change in their life. So going there, sometimes multiple times, not just once or twice, multiple times, have them get used to the environment can help. Another one is giving a lot of advanced warning whenever a big transition is coming up. Hey, tomorrow we're doing this, or in 2 weeks from now, we're going to be flying down to so-and-so. Just little reminders. But the other thing to keep in mind, like I mentioned before, is to be flexible. And how do we do this? We've got to be able to practice. So trying to build in small little changes here and there so they can develop a tolerance for these small changes. And one thing that you can do to help with a motivation to help them challenge themselves and face these new challenges is to use what they're interested in. Use their specific interest or their fixated interest in what they enjoy and use that as a reward. And these things, when they challenge themselves, you should cherish that. You should encourage that. You should praise that, because this is huge for them to be able to make these little changes and challenge their anxiety. The second thing that I want to go over that can help with your teen is to teach them how to recognize their anxiety. So sometimes working with a therapist is going to be able to help with this, to where they can work with your teen. And if you're capable of doing this, try it out. But working with your teen and being able to recognize their anxiety symptoms long before it becomes impairing. So one thing that I will do with kids and teens is I'll develop almost like a thermometer, to where with a level 1 or a temperature number 1, our anxiety is really low. But at 10, we are all the way up there. We're very elevated. We're very, very anxious at that point in time. And having a hierarchy of what does our body feel like? What's going on in our mind? Where's our heart rate at? Where's our breathing at? Do we feel on edge? Is there muscle tension going on? Developing a working knowledge of how our bodies work when we start to get anxious can help us recognize when we're getting anxious well before we start getting so elevated we can't pull ourselves back. And usually what I tell folks is around a 3 or a 4 on that thermometer, that's when we really got to pull ourselves back and recognize that we're anxious and start using some coping skills to bring us back down. Because once you're at like a 7 or definitely an 8 and above, you're going to be so overwhelmed and so elevated with anxiety, it's going to be hard to pull yourself back. Going back to some of the visual systems, sometimes you can put out that thermometer and maybe they don't have the words at the moment, so they can fill in where they are right now. You can even get creative with it to where you put their special interests in there. If they're really into cars, you can add some cars to it. And one thing to really do is what's called emotional mapping, to where you're attaching their physical symptoms, because that's going to be concrete for them. Oh, my heart rate is increased. Oh, I am breathing more than usual, to their anxiety. Because when people get really anxious, we are going to have these physical responses to it. And having them become aware of what those physical responses are so they can be like, oh, my body's feeling this way. Am I feeling anxious? Yes, I am. And another thing that I'll probably mention a couple more times is to practice this together. Practice what these signals look like. That way you can help them identify how to see them and how to see them before they get so bad that it's hard for them to pull themselves back. So guys, that's it for this video. However, I have a part 2 where I finish up. I'm going to talk about some more coping skills and some more ways that you can support your team. If you like this video, please hit like and subscribe, and I will make sure to put part 2 right up there. All right, hopefully I'll see you there. Take care. Bye-bye.